Years ago, lung cancer was considered primarily a disease of men, and that was mostly because in the past, marketing with tobacco was kind of forwarded towards men, and women were considered classy or sophisticated if they smoked. That changed. Then it became an empowering thing to smoke, and there was more marketing directed towards women in smoking. And so the numbers went up of women smokers. Thus, the numbers of lung cancers went up with women smokers. But despite that, what we have found is that women have a higher risk of getting lung cancer if they smoke. So, pack for pack, a man smoking versus a woman smoking, a woman is more likely to get lung cancer. And there are several genetic things that we've found that increase this risk. How we metabolize nicotine as opposed to how men do, it makes a difference. Although when we think of women, we think of breast cancers and ovarian cancers and as being women's cancers. Lung cancer is actually a woman's cancer. It's 1-to-1 now, and women are dying. Lung cancer is the #1 cause of cancer mortality in women today, more than breast and colon cancer put together. So it's significant. Plenty of women that get lung cancer that have never smoked. Perhaps the risk factors for secondhand smoking are greater. We know for sure that there are genetic differences that are causing this. And so there's lots of research looking into why that is. The treatment isn't much different than men with lung cancer. First is staging and diagnosis. There are lots of modalities for staging and diagnosis. We do bronchoscopy, we do PET scan, we do mediastinoscopy, we do diagnostic surgeries to help diagnose these women. And then after diagnosis and staging, if they are a surgical candidate, then they present to the operating room, and hopefully we can get a cure that way. The fact of the matter is, it's not a death sentence. We have treatments. And a lot of people come to surgeons not even knowing that, thinking, oh goodness, I have lung cancer and this is it, I'm gonna die. And that's not true, especially now that we have patients coming with lesser stage disease due to cancer screening. So I basically tell them the truth, like, this is not a death sentence. This is treatable. We will treat it, and we will be there with you along the way.